Drug and alcohol abuse is one of the major problems facing youth today. Children experiment with drugs at alarmingly early ages. In the United States, the average age for onset cigarette use is 5th grade. For alcohol is 6th grade, and for marijuana is 7th grade. However, recent surveys indicate that youth on the Flathead Reservation here in Montana are initiated into drug and alcohol use at even earlier ages. Native American children are particularly vulnerable to drug and alcohol abuse because of many factors, including economic, cultural, and societal factors. Perhaps the foremost factor involved is the widespread abuse of drugs and alcohol modeled to young children, reflecting that this is the norm. The state of Montana reports that 70% of the native population abuses alcohol. Therefore, 100% of Native people are directly or indirectly affected by substance abuse. This prevalent use of alcohol has become ingrained in reservation culture, thereby saying to young children, this is what it is to be Indian. Dysfunctional families is a term used to describe families that operate in such a way that the parents fail to meet the children's basic physical, social, emotional, and cognitive needs. Since children's basic needs are not met in dysfunctional families, the children also lack in self-esteem, guidance, cultural values, and problem-solving abilities. The parents within dysfunctional families are not meeting their children's needs because a chemical substance is in control of their abilities and their lives. It is not that these parents don't love or don't want their children. Also, adults who have not themselves experienced a healthy childhood have little to fall back on in order to provide a more healthy childhood for their family. Children who grow up in dysfunctional families learn to survive, and often by becoming chemically dependent themselves. Thereby, the generational cycle of substance abuse is perpetuated. The purpose of these video programs is to educate those who work with and teach young Native American children in order to break these cycles of chemical abuse. There will be 2 parts to this series of programs. Part 1 is entitled Supporting Children from Dysfunctional Families. Part 2 is entitled Ending the Cycles of Hurt. That is, how to provide children with information and skills before they are exposed to making decisions about drug abuse. Since the loss of a cultural identity and support system is a major issue in substance abuse, this video will incorporate issues relative to the Native American cultures on the Flathead Indian Reservation in regards to education, values, and traditions. Traditional cultural values and historical processes need to be rediscovered in order to envision a more positive future for children. This program, Supporting Children from Dysfunctional Families, is intended for use by teachers, child care providers, counselors, and others who work with young children. The purpose of the program is to provide information as to how to best support children from dysfunctional families. The most effective programs in dealing with substance abuse operate from a family focus involving all members in the healing process. However, since many individuals who work with young children do not have contacts with the family, or if the family is not involved in a healing process, the family-centered approach may not be possible. This tape, therefore, will hopefully offer some assistance to help meet the needs of children from dysfunctional families. To begin part 1 of this series, we first need to look at some of the characteristics of a dysfunctional family.
It's no secret that Indians are facing a high rate of alcoholism today. And with that in mind, in my job setting, I come in contact with some very sad stories in Indian children's lives and the effects, the impact this has on our future generations, so to speak. These are going to be our leaders. maybe we as counselors, as teachers, as parents, as adult role models, what are we doing to our Indian future generations, the children? And with that in mind, I think I'd just like to talk on dysfunctional families. Basically, when we introduce this topic to Indian people that come and we work with them in a family setting, a family therapy, when we introduce this, they and I myself wonder what is a functional family, because depending on your background, it's easy to stop and look at something that is wrong, but what are we doing that's right too? And Indian families, I think there are some really good things that are happening that is functional. It serves a purpose. It is something positive for the children to learn, a way to act, a way to be, their self-image, their self-esteem. There are some positive things in a functional family. And where I work, we pretty much also want to address that, and we want to move on into a dysfunctional family where we have the alcoholic basically calling all the shots, telling people what to do, when to do it, when they can laugh, when they can be quiet, when they're supposed to enjoy themselves, or when they're supposed to. Pretty much the alcoholic in a dysfunctional family kind of has control. And what has control of the alcoholic is the alcohol. And when you have those factors, alcohol, an alcoholic, and you have family members, children, and the spouse, then you have a dysfunctional family where there is something off balance in that family. And from that can arise probably the characteristics, like of the children, some of the roles that they take on, because one way or another that family is going to function, and it'll function in a dysfunctional manner, but it's not beneficial for the children to take on the various roles that they do in order to make that family go and make that family make it through the day, maybe pay the bills, maybe put up a good front at school. The children take on various roles in order to let that family make it. They survive, basically. You survive in a dysfunctional family. You don't truly live or experience good things in life. Maybe some of your holidays, your Christmases are really sad. When it's Christmas Eve and the drunk comes home and knocks the tree down. You got the hero child that's trying to keep a lid on everything. You've got the rebel child that just pretty much acts out. By acting out, that's like counselor jargon. That means they rebel. They stand up and they say, there's something wrong here, and I'm going to let everybody know it. And so that's the rebel child role. And then there's the child where they might be the clown. Even in the saddest Christmas day, the clown's going to try to make everybody feel better and meet their emotional needs and say, look on the bright side, things could be worse. And the clown child takes on those characteristics just to make things easier on everybody, probably emotionally, is what they do. And then there's the lost child, the child that just goes into the bedroom, or the child that can watch television while this is taking place, while the tree is getting knocked down, while the alcoholic is arguing with the spouse. The lost child can pretty much tune everything out because they're going to survive through that holiday. That's just an example of a dysfunctional family and what alcoholism, the impact alcoholism can have on these children's lives. And so the characteristics that they take on is going to be, it's going to be how they are in school too. You might have an oldest child being a hero child, trying their best to get good grades and put up a good front in front of the teachers, telling them that things are okay at home. Probably a 7 and 8-year-old feeding breakfast for the rest of the children. Or a 10-year-old who can handle not only cooking but can also do the laundry for everybody and keep up that good front so that, you know, someone won't know really what's happening at home. So one way or another, people in the family are going to survive. They may not truly live and enjoy life, but they survive through it, through the fact that alcoholism is controlling their home environment. You know, so growing up with that background and myself being in recovery, not using drugs and alcohol, when I work with these Indian children, it really lets me try my best to have a better understanding about where they're coming from, what's really going on.
The first stage of recovery for children from dysfunctional families is identification. As Carol pointed out, children who grow up in dysfunctional families are shaped, and most of them grow up in isolation. By isolation, not necessarily referring to children being physically isolated, but rather emotional needs are not met. Alcoholism in our society is something very hard for many people to talk about. Although we may refer to alcoholism as a disease, we often treat it as a shame. Also, many people fear that if the disease is acknowledged, someone may get hurt. For example, you may hear someone saying, "I didn't want to refer to the child about her father's drinking because I was afraid it would hurt her feelings." The first part in working with children from dysfunctional families is to break the silence. We need to listen to and talk to children about their situation and about the faulty messages that they may be receiving. For example, children often feel that something bad about themselves caused their parents' condition. Next, we need to help them sort out their feelings and values. It is important to listen to children without passing judgment and to respect children's honoring of their parents.
We've never learned how to trust our feelings and our perceptions, because someone was always there to say, "Oh, that isn't really what's going on," or, you know, what you really see is not really happening. You know, you're distorted somehow. So we don't speak against very many things because we're afraid somebody's going to say that, you know. Well, you're crazy, you know. That's a classical statement, you know. Well, yeah, when you grow up in a dysfunctional family, it usually is crazy. You know, things are pretty crazy, so we grow up thinking that we're crazy. So when we start to clear away the fog through recovery or, you know, dealing with these issues, personal issues in counseling or however we choose to deal with it, and you know, the fog starts to clear, then we are more able to get back in touch with that childhood innocence. And I think it's crucial for teachers, you know, to really look at where, not only Indian kids, but any kids that they're teaching in class, what their environment is. You know, are they coming from an alcoholic home? Are they coming from, you know, watching their mom getting beat up all the time? Because if they are, they're living in a tremendous trauma. And they're not able to function in their environment as a child should be allowed to. And if this is addressed in school, if we start giving back responsibility to parents, you know, to deal with the problem, then I think we're going to start having a more healthy society. And we'll be able, once we heal in here, we'll be able to reach out there for our culture. It'll be there. We can't lose it. And we're confused. You know, a lot of our kids, I've run into a lot of kids in the schools where they'd rather not talk about it, you know, because they're confused and they don't want to acknowledge the fact that they've lost their identity. A lot of our kids are hurting today because they don't know where they fit. They don't know what their role is. They don't know anything about who they are. They're not taught to feel good about themselves. There's always that faulty feeling, you know, something's wrong with me, something's not quite right. And it's getting better, you know, more schools are doing are confronting alcoholism, confronting destructive behaviors, and helping all of us, apart from culture and Indianness and, and all these labels, just identifying who we are as human beings, looking at the pain, looking at the hurt, looking at what we can do to change, looking at what we want to teach our children, and modeling being good to each other, accepting each other, no matter what color you are, no matter what background you have. Because I know when I was growing up, there was things said about other tribes of Indians that were negative, or other colors of people that were negative. And thank goodness that didn't rub off on me. But the teachings were there, And it's something, we've lost the ability to put a purpose to mistakes or even suffering. And when we can give a purpose to suffering, and we don't mind suffering so much, when it's for a reason. But not the kind of suffering where you're being beaten emotionally or verbally or mentally or physically. There's ways to draw lines in what we value. Boundaries. Setting boundaries is important. That's something that we've lost. Ability to set boundaries, ability to say, this is the line that you do not cross.
The process of getting children to open up is not always an easy process.
They're going to remember things that we do versus things that I stand and preach to them. They're going to remember hands-on learning. If I helped them make an Indian outfit, or if I helped them learn something about nature, I think that they're going to remember those things.
And we need to, most of all, communicate with our children, which a lot of the generation right now doesn't know how to do. We can't even communicate with each other, let alone our children. So we need to learn how to do that, and take parenting classes and reach out for people who are the resources to teach us how to do this. Let our children know that our culture has collapsed, that we've lost a lot of our beliefs. Be honest about where we are as Native people, but don't stereotype. Continue on. I know Indian people do that to themselves too. But to be honest about where we're at, what our struggles are, what our feeling and emotions are, and share that with our children. In my own family, I've, like I said before, I've had to cry with my kids when I feel the frustration of being a single parent, in the process of recovering my own identity as a Native American. I share with my kids the thoughts I have, the struggle, and that encourages them to share with me. I'm in saying that and in modeling that, I'm telling them that that's okay for them to do it too.
The next step after acknowledging and breaking the silence is to offer sincere comfort and support and enhance the child's self-esteem, self-concept, and cultural pride.
And some of the things I talked about before was the self-esteem, believing in themselves. Encouraging them that Indian children have a beautiful culture. They have something very unique. Not discouraging them. I worked with a little Indian boy one time, and he came out there and he put on yellow and blue and red paint, and he had him on his face. And so I told him, I said, did you put that paint on yourself? Yeah, he said. And I said, what does that mean, that you put that paint on? Is there some reason why you put it on? And he said, because I'm an Indian. And I said, well, how about when you take that paint off? Are you still an Indian? And he was about 4 or 5 years old, I think. And he says, well, I'm not sure. He wasn't sure what to say about it. I thought he was really cute because, and I told him, I said, you're always Indian. I said, you're going to be Indian all the time. And that's beautiful. Being an Indian is beautiful. I told that little boy, and he kind of wasn't sure, but it was really cute to work with him. He's a cute guy. He thought the props, and the things that we tied on him was going to make him Indian. But I was trying to work with him a little bit, and just to let him know that that's what he's going to be, Whether he finishes school, whether he goes on to college, whether he becomes working at Post and Pole, he's Indian first. And be proud of that, despite the fact that there is a lot of sad things in our culture that has taken place. And what I'd really like to concentrate on is when I work with the children, what can I do? What can I do to let this be a positive interaction for them? And this one word, it's called culturally sensitive. I don't know what it is about that word, but something in there just don't hit me right. Because to me, it's downright respect. Have respect for someone even though you don't know why they're doing what they're doing. They're doing it for a purpose. I guess that's just a choice of words or something that certain people have different ways of expressing it. But if a teacher, a non-Indian teacher, is trying to interact with an Indian child, number one thing, open your mind a little bit. Realize that the child is an Indian. Realize that the child deserves a fair chance. Realize that the child is just as talented as the other children in the classroom. And has just as much potential as the other children. There's this one little balloon story. I don't know if you want the story on here, but I'll tell this little story. You probably heard of it too. This little boy, a little Indian boy, went out in the park, and this balloon man had his machine, and he was putting helium in all these balloons. He had red and yellow and pink and blue. And he put all these balloons, and he put this helium in these balloons. He has these balloons floating around, and the little Indian boy walked up, and he noticed that the man let go of one of those balloons, and he let a white one go up, and then he let a yellow one go up. And that little Indian boy said, if you take that brown balloon and you let it fly up, will it go just as high as the white balloon and as high as the yellow balloon? And the man says, oh, sure. He says, these balloons can fly. They're all going to fly high. He says, the only thing that matters is what's inside the balloon. And so the little boy was wondering if Indian people can compete with other nationalities. And the man told him, it just depends on what's inside. So that's with some of my stuff, working with the children, I like to tell them to believe in themselves. Believe that they can do it. Believe that it's right there in the palm of their hand. But they have to believe in themselves so that they can reach out and grab it. So I thought that story was real cute. Depends on what's inside your heart and your mind.
One culturally relevant activity designed to enhance the child's self-esteem and self-concept is to focus on their names. If possible, have parents report as to how the child's name was chosen and share this during group time. Help the child recognize his or her printed name. Paint it, glue it, color it. Sing songs using children's names.
Busy, busy bumblebee, can you say your name for me?
From henceforth they might gain an identity. First of all, a name. Like in Indian culture, an important thing for a young child is to have a name right away when they're little, when they're first born. So that, along with that name, goes a purpose, depending on what the name is, their Indian name. And maybe in some Indian children, perhaps from urban backgrounds, might not get to benefit in that, as far as getting the full benefit of an Indian name and having an identity that can pretty much carry them through life.
The third stage in the recovery process is resolving grief and pain, and then allowing it to pass.
You know, I grew up in a dysfunctional home and a dysfunctional society that never allowed me to feel good about anything that I knew or anything that I felt or see myself in a positive way. There was always something wrong somewhere. You know, it could be better, it could be different. So I grew up in that way of thinking and never feeling good about my identity as a Native American. I guess I grew up focusing on the dysfunction, focusing on what my life was about, my environment was about. And along with other elders and things that other elders have said about what our culture is and isn't, what our values are or aren't, looking at what the truth is, unlearning my dysfunction and learning how to function as naturally and as healthily as I can. I don't want to say normal. I don't like that word normal because you got to live up to something if you use the word normal. You know, if you did something well or did something good, no one ever said, "Good job," or "You're special," or "I'm proud of you." That was said a few times, you know. But there was always another side to that is, "I'm proud of you, but you could have done better." You know, like what I could do, what I was able to do just wasn't quite enough. Well, I've had to unlearn that and let go of that, grieve that, and know that my parents and my grandparents and the people that began the transition from our culture as it was before the influence, before any kind of influence, did the best they could with what they had.
Perhaps the best place to start in order to help children resolve their pain is to first resolve our own. Whether our pain is caused from drugs, alcohol, or racism, we first need to look at how our families functioned and how we were shaped, and what emotional legacies were handed down to us. That way, we in turn can look at how we are shaping our children and the children that we work with, and what legacies we're handing down to them. The most positive legacies that we can hand to children are the legacies of trust, communication, and love. All healing starts with an inner focus. It is a process of learning new ways and seeking new legacies and replacing what we let go.
We're going to. I really believe that that's a future, that's an out for us. Quick, help me.
Yeah. Recovery is one of the big words in that circle. And what I see it is, we need to recover the beauty that was in our cultures and do away with the damage.